The New York Times highlights 5 key takeaways from the hearing of the ousted CDC director, Susan Monarez. However, there is a 6th takeaway following a question from Patty Murray to both Drs. Monarez and Houry.
Well, the Secretary has made very clear that he wants to change the childhood vaccine schedule for measles and chickenpox and Hep B, as well as the COVID vaccine recommendations. And as we all know, the ACIP is meeting tomorrow to consider those recommendations. Dr. Monarez and Dr. Houry, I want to ask you both, are you aware of any scientific evidence to support changing the age of which children should get these vaccines that's being considered by this advisory committee? Dr. Monarez.
I am not. I was certainly open if there were scientific data sets or evidence associated with anything that would help keep our children safe. I was open to seeing it. I have not seen that data.
Dr. Houry.
Ditto. We've asked for the data and asked for the modeling to support any decision that is done.
Are either of you aware of any scientific evidence to support changing eligibility for COVID vaccinations?
I have not seen any evidence.
No.
The CDC's latest 2025 breakdown is a 5-year follow-up of deaths by age group. Notably, there is no significant COVID-19 death rate among individuals under 18 based on 5 years of data. More CDC data from 2025 shows a decline in COVID-19 hospitalizations across all age groups since the 2021-2022 season. Hospitalization rates for those under 18 have decreased to minimal levels, reflecting the pandemic's diminishing impact. Analysis from October 2022 to April 2024 reveals that most older children hospitalized with COVID-19 have underlying medical conditions, so they are not healthy. This data undermines vaccinating healthy children. CDC data from 2025 shows that only 13 to 14% of parents trust the CDC and vaccinate their children for COVID-19. That means 87% of healthy children are not being vaccinated, yet the incidence of hospitalization is in freefall, along with the reduced vaccinations, further undermining the need to vaccinate all healthy children over 6 months. Yet these 2 high-level officials from the same CDC know of no evidence to revisit the recommended COVID-19 vaccination schedule. Is there no evidence? Is the risk of vaccine complications justified for healthy children? The CDC collects the data, and these CDC leaders have not seen any.